Yes, so my assignment today is to make sure that you do not forget prioritization for life in your NCLEX exam and even for your practice, because that is what will make you a safe nurse. So always remember this. I'm going to prioritize the unstable client first before I see the stable client. And we went through the indicators for instability and the indicators for stability. And yes, I will prioritize that client who is acutely ill before I see the client with the chronic illness. And I'll always remember that when I have a freshly post-op client, just about 12 hours after surgery, I'm going to prioritize that client. And always remember that you're going to prioritize the most vital organ. If a client is having an issue and now it started to affect the brain, client is having a reduced level of consciousness, client is now confused, client is now having seizures, the brain is now involved, and you will prioritize the most vital organ. And always remember this: unstable, unstable, unstable. These clients are always unstable. High fever over 40.5 degrees Celsius. That is around 105 degrees Fahrenheit. Clients with hemorrhage, clients can get into shock. Clients with hypoglycemia. Hypoglycemia can kill the clients very quick. A breathless client. Clients with pulselessness. Always remember, let this ring in your ear. Unstable, unstable, unstable. Remember I think you should just capture my voice in your ears when you see that question. Unstable, unstable. Remember Dr. Julia saying unstable, unstable, unstable. Please pick the correct answer. And yes, as we do it here, we always give some mnemonics to serve as a guide. There's this mnemonic that puts together the 8 key prioritization for client. Use the mnemonic ask graph is also a guide if you remember the mnemonic. And as I said, airway has to be prioritized as well. But always remember the other rules and know which one should be prioritized first. Sepsis, client with sepsis. Potassium. Issues with potassium will affect the heart. So always look at clients with derangement in their potassium values. Glucose, hypoglycemia. The R, lethargy. A, altered mental status. So brain, you have to prioritize it. Acute peritonitis has to be prioritized. Peritonitis is dangerous. And then hemorrhage. Clients can bleed and then land in shock. So let this ask graph mnemonic serve as a guide. If you forget anything, I pray you remember this as well. And we shared the Maslow's hierarchy of needs. Physiological needs should be prioritized before safety, love and belonging, self-esteem, and self-actualization.